Hello again, this is Dr. John Hoy, physician and surgeon of the foot and ankle, practicing in the heart of downtown Seattle, Washington. Welcome to my treatment room. Today we are going to be talking about arthritis, more specifically osteoarthritis of the foot and ankle. What is osteoarthritis? Osteoarthritis is a condition characterized by the breakdown and eventual loss of cartilage in one or more joints. Cartilage, which is the connective tissue found at the end of the bones and joints, protect and cushions the bones during movement. When the cartilage deteriorates or is lost, symptoms develop that can restrict one's ability to easily perform daily activities. Osteoarthritis is also known as degenerative arthritis, reflecting its nature to develop as part of the aging process. Osteoarthritis is the most common form of arthritis, and it affects millions of Americans. Many people refer to osteoarthritis, of course, simply as arthritis, even though there are more than 100 different types of arthritis. Osteoarthritis appears at various joints throughout the body, including the hands, feet, spine, hips, and knees. In the foot, the disease most frequently occurs in the big toe joint, although it is often found in the midfoot as well as the ankles. Now let's look at the signs and symptoms of osteoarthritis. People with osteoarthritis in the foot or ankle experience, in varying degrees, one or more of the following: pain and stiffness in the joint, swelling in or near the joint, difficulty walking or bending the joint. Some patients with osteoarthritis also develop a bone spur or a bony protrusion at the affected joint. Shoe pressure then may cause pain at the site of the bone spur, and in some cases, blisters or calluses may form over the surface. Bone spurs can also limit the movement of the joint. Let's look at some of the causes of osteoarthritis. Osteoarthritis is considered a wear and tear disease because the cartilage in the joint wears down with repeated stress and use over time. As the cartilage deteriorates and gets thinner, the bones lose their protective covering and eventually rub together, causing pain and inflammation of the joint. An injury may also lead to osteoarthritis, although it may take months or years after the injury for the condition to develop. For example, osteoarthritis in the big toe is often caused by kicking or jamming the toe or by dropping something on the toe. Osteoarthritis in the midfoot is often caused by dropping something on it or by a sprain or a fracture. In the ankle, osteoarthritis is usually caused by a fracture and occasionally by a severe sprain. Sometimes osteoarthritis develops as a result of abnormal foot mechanics. People who have flat feet or high arches are at increased risk for developing osteoarthritis in the foot. A flat foot causes less stability in the ligaments or the bands of tissues that connect the bones, resulting in excessive strain on the joints, which can cause arthritis. A high arched foot is rigid and it lacks mobility, and this causes a jamming of the joints that cause an increased risk of arthritis. Let's look at diagnosing arthritis. So, in order to diagnose osteoarthritis, we will examine the feet, looking for swelling in the joints, limited mobility, and pain with movement. In some cases, a deformity or an enlargement, such as a spur in the joint, may be noted. In addition to the foot examination, X-rays may be ordered to help diagnose osteoarthritis and evaluate the extent of the disease in the foot and the ankle. Let's look at some of the treatments of osteoarthritis. First, the non-surgical. To help relieve symptoms, some of these modalities can be used. First, oral medications. Nonsteroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen, can be helpful in reducing the inflammation and pain. Occasionally, a prescription for a steroid medication is needed to adequately reduce the symptoms, especially if they're severe. Also, nutritional supplements may provide some long-term benefit. Orthotic devices. Custom orthotic devices or shoe inserts are often prescribed to provide support to improve the foot's mechanics or cushioning to help minimize the pain. Bracing. Bracing, which restricts motion and supports the joint, can help reduce pain during walking and help prevent further deformity. Immobilization. Protecting the foot from movement by wearing a cast or removable cast boot may be necessary to allow the inflammation to resolve. Steroid injections. In some cases, steroid injections are applied into the affected joint to deliver the anti-inflammatory medication. Physical therapy. Exercises can be employed to strengthen the muscles, especially when the osteoarthritis occurs in the ankle. This may give the patient greater stability and help avoid injury that can worsen the condition. So when is surgery necessary? Usually if the non-surgical treatment fails to adequately reduce the pain associated with osteoarthritis, surgery may be recommended. The goal of surgery is to decrease pain and improve function. We will consider a number of factors when selecting the procedure best suited for your condition and lifestyle. Thank you very much. Take care and have a great day.